what is a heart attack? Dr. Rawat, what is a heart attack?
Now, heart attack is not a joke.
तो heart attack में सर heart बंद भी हो जाता है क्या?
Yes. When there is 100% of blockage, it is in danger.
When we say it is a straight line, it's extremely scary. Dr. 𝗶𝗶𝗧𝗹𝗀, how do we revive these massive cardiac arrests which happen?
Then we go for a shock.
How young are you seeing patients coming in your tenure of practice?
I have seen a person as young as 23, 24 years old. You are some 50, 60, 70, something like that. Then you always keep this diagnosis of heart attack one step higher than gastritis.
So cardiac arrest is not shopping. Please understand that you're losing time. ये जो जिम करते हैं, ये जो प्रोटीन पाउडर लेते हैं, these protein powders and these extra steroids that they pump in for their beautiful body, that also ignites to heart attack?
Exactly, because steroids and all, they decrease the immunity of the body. They mostly listen to the gym trainer and they take gym trainer to be their doctor. Then any other.
The time span is very less. This is one organ. If it stops, you just don't have an alternative. Namaskar. I welcome you all for another episode of Kalinga Med Talk. My name is Nilanjana Mukherjee. I'm the Managing Director of Kalinga Hospital Limited. As you know that we've been coming up with different episodes of Kalinga Med Talk. आज जो मामला है वो दिल का मामला है. So we are speaking about heart attacks today. What is a heart attack and how do we deal with it? So we have got this very young and a very dynamic cardiologist with us, Dr. 𝗶𝗶𝗧𝗹𝗀, who is actually joined as a full-time consultant with Kalinga and is doing commendable job regarding not only heart attacks but has saved a lot of patients' life in this process. I would request sir to introduce himself and tell our viewers exactly the areas which he is working in.
Hello everybody, I am Dr. 𝗶𝗶𝗧𝗹𝗀, interventional cardiologist, and at present I am a consultant cardiologist working in Kalinga Hospital, Bhubaneswar. And my area of field, it includes angiogram, angioplasty, attending the patients and addressing them clinically. Then it also includes putting a temporary pacemaker, permanent pacemaker, AICDs, CRTDs, and so the majority of the patient who come with this chest pain and with rhythm difficulties, so I try to deal with them.
Thank you, sir. Welcome to this Kalinga Med Talk. So the idea of Kalinga Med Talk is basically to inform our viewers who have certain basic questions of certain realities of life. So to start with, since today's topic is heart attack, sir, what is a heart attack? Dr. Rawat, what is a heart attack?
Okay, so it's a very nice question, heart attack, and the very word it creates panic. So there is an assault over the heart. Heart being the most important organ that pumps blood to all the parts of the body. I mean to say it carries oxygen to all the parts of the body. That is essential for the organs to sustain their life. So just like heart contracts and it propels blood through the arteries carrying oxygen, same way the heart muscles also, they need oxygen to survive. So when these the arteries, I mean to say the channels that supply blood to the heart, it gets blocked. So adequate blood supply to the heart, it gets impeded. Once it gets impeded, the function of the heart, it deteriorates. So the cause for which it deteriorates, that is an attack. So this is basically heart attack. So the heart is attacked and it is in danger.
तो heart attack में sir heart बंद भी हो जाता है क्या?
Yes. So when the attack is severe, when there is 100% of blockage, it depends on the area. So there are 3 coronary arteries, 2 on the left side and 1 on the right side. Sometimes it so happens that 70% of the blood is supplied mostly by the left side and 30% the right side. So supposing from the beginning there is 100% occlusion, then a massive territory is gone. So at that time you can have a sudden cardiac arrest because maybe due to some rhythm defect or most of the muscles they get damaged, and so the ECG line it falls flat, which is called cardiac arrest. The pumping is abruptly it stopped.
It sounds extremely scary in real life, and when we say it is a straight line, it's extremely scary. But in my professional life, we have seen lot of doctors reviving those patients. So abhi Dr. Saab will tell us, Dr. Sabyasachi, this how do we revive these massive cardiac arrests which happen? What is the method? What do we do?
Okay, see now it would be explained in two contexts, like supposing there is massive cardiac arrest outside the hospital. Supposing somebody has gone for a movie or for some any other purpose, he's outside the hospital and he gets a massive cardiac arrest. Then the immediate thing that people they do is that, or who can do, it's a CPR, and most of them they have seen through the social media or television how to do a CPR on the left side. They have to press. So that is the minimum thing that they can do if a cardiac arrest is outside. Then we go for a shock, or again the patient is immediately shifted to the Cath Lab, and because of the blockage, if he has mostly it is due to blockage, and if there is blockage, then we shift the patient immediately to the Cath Lab, and then we try to revascularize. The revascularize means we try to remove the block.
As in treat the patient?
Yes, to treat the patient. So then that gives fresh leash of life to the heart, and the cardiac arrest is reverted to normalcy.
So Dr. Raut, another question which I have is that a lot of cardiac arrests are very mistaken. What is your information to the viewers is when is the symptoms of a typical cardiac arrest when we are outside?
Okay, cardiac arrest meant to say heart attack. Okay,
heart attack,
fine.
Yeah. What is the symptoms which come?
Okay, see, so the confusion arises that most of the patient they confuse between this in common man's term heart attack with gastritis.
Yes.
So everybody you ask in the state or in the country, everybody you ask first diagnosis, the self-diagnosis that make is it is acidity. Now why acidity? Because it happens around this chest area, so they think that this is the first diagnosis, then this heart attack it comes later. Then they will try to relate to, they would have eaten some tea, they would have eaten some bara piyaji, some extra, and they would correlate, and they remain self-satisfied. No, it's just that. Let me tell that heart attack, it means in case of heart attack, time is muscle. The more time you lose, the more you jeopardize your heart. And you never know, once you have a heart attack, how soon, how far it will progress, that will not be under your control. So if you have some risk factor, supposing you are an aged person, then you try to diagnose heart attack fast than this gastritis problem. And okay, gastric problem is just a burning sensation that will have over the chest. But again, that can be confused also with this heart attack. Same kind of pain it may happen on your chest, and simultaneously some tricks like if you notice there is abrupt sweating, you are perfectly fine. All of a sudden there is abrupt sweating, or if there is the pain is like pressure pain, squeezing pain, as if somebody is squeezing you very tight, or supposing there is immediately you feel that you are breathless. And so in that case, acidity and all, they don't come with such kind of thing.
Okay.
These additional things, they don't come.
Okay.
And and when you start working, the pain again aggravates. Acidity pain, it remains constant. So in that case, your first diagnosis, and supposing you are not an adult, I mean to say you are not a young fellow, but you are some 50, 60, 70, something like that, then you always keep this diagnosis of heart attack one step higher than gastritis. Some kind of relaxation is there for 20-30 years old. Though heart attack now it has touched every age, still then you can console yourself that it could be a gastritis. But if you are a senior citizen, if you have diabetes, blood pressure, or any comorbidities or any risk factor, first diagnose that it is a heart attack and avail medicine, medical facility.
Medical facility. So what डॉक्टर साहब बोलना चाह रहे हैं कि आप जो सोचते हैं कि ये गैस्ट्राइटिस पेन है, और आप बैठ जाते हैं सोच के कि हाँ एक एंटासिड ले लेंगे तो हमारा गैस्ट्राइटिस पेन ठीक हो जाएगा. But when you are 50 above, when you are already having diabetes, hypertension, don't neglect it. आप मत सोचिए कि ये गैस्ट्राइटिस है और हम हम जा सकते हैं बाद में. स्वेटिंग इज़ अ वेरी बिग इम्पॉर्टेंट एरिया जहाँ पे आपका हार्ट अटैक होने से स्वेटिंग और दबाव होता है, जॉ पेन होता है. सो लेट्स नॉट टेक द रिस्क. नाउ डॉक्टर साहब ने एक बहुत अच्छा, ही सेड अ वेरी पर्टिनेंट पॉइंट, is that heart attack does not come with age. It's coming with very youngsters nowadays, and we like KK just passed away. He just passed away, and believe me viewers, the place he was performing, just opposite is a medical college, just beside is the hospital, but nothing could be revived because again he thought it to be a gastritis and he had taken gastritis pills. So I would like to ask Dr. Sabyasachi is, how young are you seeing patients coming in your tenure of practice?
Okay, I have seen a person as young as 23, 24 years old. 5 years back, one boy, he rushed into the casualty, and he told that he was some Mr. Odisha, something like that. So, and he was totally physically, he was very strong looking. He presented with a massive heart attack as young as 23 years of old. And when we rushed him to the Cath Lab, his first question was that, "Doctor, I am so physically fit, and very recently he had won some Mr. Odisha competition, and still then how could it happen to him?" And that he's only 23 or 24 years old. But when history was taken, so he was taking some steroids and all so as to boost up his muscles and all. I don't know at whose BST he was taking, so which was a very dangerous thing, and which has the propensity to precipitate or to bring a heart attack even in the young. And his dietary habit was also very erratic, and it was fat loaded. So there were a lot of things when we investigated about the cause of.
So you mean to say that ये जो जिम करते हैं, ये जो प्रोटीन पाउडर लेते हैं, these protein powders and these extra steroids that they pump in for their beautiful body, that also ignites to heart attack?
Exactly, because steroids and all, they decrease the immunity of the body, and they accelerate a lot of things inside the body. And first of all, when you will advise them that you don't take, they mostly listen to the gym trainer, and they take gym trainer to be their doctor. Than any other medical specialty person. So they strictly adhere to what he says. So finally they land up with problem because I don't know, mostly the protein diet, what kind of they advise, but mostly it is steroid loaded.
So what sir said, Dr. Sabyasachi said that the youngsters are believing their gym trainer, and what looks good, जो दिखता है वो अंदर से नहीं भी अच्छा हो सकता है. And depending on protein powder, steroids is something which you are constantly trying to look and compete in the Instagram, in the social media. But inside you're getting hollow day by day. Now I will come to a very pertinent thing in my career and sir's career which I've seen is when you come with this kind of an arrest, you do not know how much the cardiologist takes a pain to save that patient because the time span is very less. This is one organ. If it stops, you just don't have an alternative. So sir, typically when a patient comes to the emergency, जब वो आते हैं emergency में with a massive cardiac arrest, what are the tests which you do? And then when you shift to the Cath Lab, what are the steps which you do? Because people don't know that you do so much of precautions before you realize that a patient has a blockage or has a massive cardiac failure.
Okay, this is a very nice question. Practical difficulties that we face basically is that to counsel the patient that he has a heart attack. Now, heart attack is not a joke. Many person, I've seen many person, they got a heart attack, and when they were counseled that you got a heart attack, and so this is an emergency. Even at the stroke of midnight, a patient would be coming to the casualty and would be hurrying out to the casualty from home to see the patient. And when you say that you are having a heart attack, so it is a emergency, and we have to take immediately to rush you to the Cath Lab because it's a primary MI. It is called primary means actually the heart takes some time, heart muscle to get damaged. So after the assault, so the best period is 12 hours. Within 12 hours, basically we call primary. So within 12 hours, we can salvage the muscle to the maximum. Still then, there is actually no time limit as such. The earliest you come, the better it is. So when the patient comes and we will be counseling, meanwhile coming to the before coming to the hospital, he would have taken some painkillers, because most of the family members and neighbors, they are doctors. Okay, so they tell that you take this, you take this. By the time they come, few would be having no pain. Now when you said that it's a dangerous pain and you have to be rushed to the Cath Lab. No, sir, there is now no pain. Now it is okay. I'm feeling better. One instance also it happened. One 70-year-old came with such kind of pain, and when I told him, he said, no, nothing. He forced his son that no, these people are just they want to get me admitted and to extract money. There's a corporate hospital, so they will do, and nothing. I'm fine. The medicine, some ultra set of painkiller was been given to him by his son, and he felt better. I requested him, you please don't leave the hospital. If you are skeptical, you stay here and you'll be kept under observation. But my immediate response would be that you should go to the echo to be done and rush to the Cath Lab for primary PCI. He didn't relent even to my words. Then he forced his son. He went outside. It was 12 or 1 a.m. Then he came after 6 a.m. He was in severe breathlessness. He was like gasping. When his blood pressure was recorded, it was not recordable. He was sweating like anything. And his son then, he caught our feet, imploring very badly that, sir, you please do something, my father is dying. I said that 6 hours before, his condition was better. His pumping was around 50-55%. The moment he came out of 5 hours and we did the echo, his pumping was around 25 to 30%. So by this time, this 25 or 30% and muscle, they got damaged. Our normal is around 55% above. So 25% is, it's the heart muscle has been damaged to a substantial level, and this pumping, it determines the outcome of a revascularization or a PCI process. We took him immediately, but we couldn't save him because it was too late. The son cried like anything, but finally said that, doctor, you tried your best, like God, to save us, but maybe when he was not destined to live. So he kicked his own fate and he went away. Few will come and say, sir, this is my first time, so why should I be serious? Just, I don't know where they have gained this concept or this notion, maybe from film. Sir, I know that if 3 times it happens, then our heart is ended. Sir, this is first time. So why? We try to convince them that first time, even maybe the last time.
Yes.
Because once heart attack happens, the progression of a heart attack is not under our control. You might be saying some people, they get the chance to come to the hospital. Some people, they succumb in 5 seconds. Some succumb in 1 minute. Some get the chance to come to the hospital and get recovered. Some come with a severe breathlessness. So you never know how 5 people of the same age, of the same intensity of heart attack, they will present. So, as I say, time is muscle. The more time you lose, the more you jeopardize your heart, and the less time you give us to salvage. So once a patient comes to the emergency, we try to explain that it's an emergency. We do an echo. First we see the ECG to know what kind of heart attack is that, whether it is atrial or inferior. Then we see the echo, because echo shows us the pumping or if how much the valve has been damaged, if there is any shunting happening or any valve problem happening, which are called mechanical complication, which it is an added danger to the outcome of the process. So we then take him to the Cath Lab. Some serology minimum tests are being told to be done in the casualty blood examination. Then after echo, we rush in, and then there we see the angiogram. Angiogram, it shows how much is the block. Whether there's, as I told before, there are 3 coronary arteries, So whether there is blockage in left side or whether there is blockage in right side, how much is the blockage, whether there is a focal lesion or there is a massive blockage, and then we try to intervene by removing the blockage, by ballooning the lesion, and then by putting a stent. So putting a stent is a narrow channel, is a hollow channel which removes the block, and it makes the passage of blood
Open.
Total passage of blood to the heart. So these are the process that we go through to salvage the life of a patient of heart attack.
So, Dr. Sabyasachi has said a very nice incident about, how patients behave in the emergency. I would like to relate one incident. It's amazing, sir. Is like, sometimes these cardiac patients come in to the emergency and then I get a call that Nilanjana, यहाँ पे treat करे कि कोई दूसरे hospital पे जाए, कि वो तीसरा डॉक्टर जो है वो बड़ा नाम किया हुआ है उसके पास जाए. So cardiac arrest is not shopping. Please understand that you're losing time. And it has been so many times in my life that I have actually counseled people that it matters where you have a setup of a cath lab, you have an emergency setup, you have a qualified intervention cardiologist. Please understand the value of time there. There have been instances where they have done an emergency में patient को stabilize किया गया है, उसके बाद बोलते हैं कि हम ना दूसरे हॉस्पिटल में ना वो फलाना डॉक्टर हैं, वो बड़े नाम वाले हैं, उनके पास जाएंगे. You lose time. You don't understand that. Now, my another question, which is very pertinent, which we face every time, is where a doctor is treating a patient, trying to save a patient in a cath lab, where the angio is done, angiography हो जाती है, then there are multiple blockage, and the doctor comes out and tells the patient patient's NOK that you have so many blockages. Now we need to do it same sitting. Sometimes it so happens कि ठीक है बाद में करेंगे. Sometimes होता है कि उसी time करना होता है. There is a financial burden for the patient NOK also. I am not denying that. But I want to ask Dr. Saab कि how important it is. When do you decide कि same sitting में उसी time में करना होता है? Because there is a myth with all the viewers is ये पैसा ऐंठने के लिए जानबूझ के pressurize कर रहे हैं. I exactly want to know exactly what is the medical duration or what is the medical situation, I would say, is where you decide.
Yeah, this is a very good question. Now, supposing a patient got a heart attack just 1 hour before and he comes to the casualty and he's having a severe pain complaint and breathlessness. Now, what for we are trying to press him that immediately we should relieve you away from this block. The main reason is that the very motive of doing everything, we say revascularization, it is called revascularization. Means there is a block and you revascularize. Vascular means the channels. So you open up the block. The very reason is to save the heart from failing. Failing means the pumping of a normal heart is around 55% and above. Now, once there is block and 100% block and no blood goes to that area starts degenerating. I mean to say, gradually it will become dead. Now, once this area becomes dead, it means that this is not going to pump. Now, it's not going to pump means the patient is going to land up in severe acute heart failure or he may go into a cardiac arrest. So, within that time frame, if there is pain, patient comes in 1 hour, 2 hour, or the earliest he comes, there is pain, then it becomes imperative for us to immediately to give him that benefit. It is not an easy task also because some people they come at the dead of the night. So patients they think about themselves, but they should also know that we leave our family, we rush in just to save that patient.
Yes.
To save that patient means because somebody we give life, the satisfaction that we get, it is far more than the attendants who have brought this patient, their own relatives and all. So this is a hard job for us also because we are going to fight through several odds like his heart condition. There will be many comorbidities like diabetes, blood pressure, dyslipidemia, higher lipid. So and when these things are there present, they are not there to make our job easy. They all are there. Their concerted effort would be to cause more serious damage. So it's more of a challenge for us to to make the patient better, fighting through all these odds. So in that case, as I said, time is muscle. You lose time, you lose the patient. Here there is no, and basically when you come to the patient or doctor, the first and the foremost thing is that just by saying that doctors are God, it means nothing. You should have 100% of faith. When you address somebody as God, it means you should have 100% of faith, just like you have 100% of faith on God. So if you have faith on us, then you should also accept that what we say, it is for your benefit.
Benefit, yes.
So because we want to see you smiling. We want that you should live in this world with a proper heart. Proper heart means heart pumping well. Because if heart pump, it goes down, then it's just like you can't move even a step. You will be sitting at your place and you will be gasping. You may succumb, or if you live, then you will live with a very bad heart. And that is a very horrible feeling. So if you have faith, then you have to respect the doctor's words, and doctor is meant to give you a fresh lease of life, a happy life and a happy heart. So that is the foremost thing that I want to say.
Second thing is, sir, which you right now said is the same sitting, which we say like angio and immediately हमने stent कर लिया. कुछ cases में sir, sometimes you say that okay fine, you do the angio and there is a blockage and you come after, and so patients insist that we will come after some days. It may be because they may arrange money, it may be because they consult their family. There may be multiple reasons for it. But once you find there is a multiple blockage in an angio, how much time do you give to a patient to come back for stenting?
Okay. Just 4 or 5 days back, one patient came. He came for an eye clearance. But he has diabetes for around 25 years. He also has hypertension. Now, while talking, I was taking history before giving the clearance. His ECG was okay, his echo was okay, and he was a thorough examiner. I mean to say, every 6 months he used to show to some cardiologist. Now, when he came for clearance, then I asked, just while asking some leading questions, he said that his daughter said that that his father gets dyspneic while walking through staircase. Then feeling dyspneic means feeling breathlessness while walking staircase at the age of 50-60. First diagnosis that you should make is that means there is some problem in the heart. He was a smoker also. Then I said that, well, I have to do a TMT at least. I have to do an angio first of all, I said. Then he said, sir, no, I were not prepared. Then I said that you do a TMT. Now then that TMT means treadmill test. Treadmill test means he has to run through one treadmill and then the ECG will be recorded. Generally when we take the ECG generally is at rest when we are comfortable. So when we are comfortably sitting, this metabolic rate is also very slow. So very slow means that ECG, it comes normal. So when TMT, we do a treadmill test, we put the heart under some activity so as to see how much pressure the heart takes. Now while doing a TMT, it came out to be positive. Then I said, TMT is positive, madam, so we need to do a angiogram and to do an angiogram before going for an operation. Then he said, then she agreed, okay, let's do, because the extent of breathlessness, she was telling that just climbing 2-3 steps, he gets restless and dyspneic or breathless. When I did an angio, there were multiple blocks. All the 3 arteries, they were blocked. And then his daughter and the patient, they got stunned. He said that for last 2 years, he was having this kind of ailment. Every 6 months, he went to a cardiologist to a different hospital, and nobody said, everybody said ECG echo is okay, so you go back home. Now they were stunned to see, and in that case, because it was a TMT positive, so I told that, madam, you have 2 options. You can go for a bypass surgery, and if you are not willing, then you can come for a multi-vessel stenting. But bypass surgery is good. But the patient said that he is having a long-term diabetes, so those wounds may not heal. Stenting it, we do it through a small perforation from here. It's a small one. So now the patient told he told that give us 10-15 days, I will be coming back. So in that case, because it was not an emergency, while doing a TMT, we detected, but those blocks, it has to be relieved also. So for that, we gave ample of time that you come at your time. But that doesn't mean that inordinate delay.
Yes, no. Yes.
You come at a time. Yes. So in that case, his echo was normal, so the pumping is good, everything is good, there is no pain, but with TMT we got this and angio saw that. So in this case we can give the patient, they can buy some time. But if they come, okay, his blockage was 90% something, but if you have a 100% blockage, in 100% blockage there is no scope that you would go outside or you take your time, you come after few days. Just like the instance that I told, that old man who said that nothing has happened, and when they came, they landed.
Everything was
Yes.
finished.
So in this case, it is different because there is 90%, 80%, so some amount of blood is flowing. But when 100% blockage is there, there is no scope that you should go.
Yes.
You should buy more time at your will. No.
Yes. So what we would like to tell our viewers is that cardiology, cardiac arrest, heart attack is not a child's play. Do not understand that, don't try to, Google it. Don't try to, shop around with doctors because you are really losing time and you never know what will hit you. And then you cannot blame the doctors that, they have not taken care. There are a lot of things which we face as hospital administrators where they say that so much of money has been extracted because of the stenting and everything. He just went hale and hearty in the emergency, but the hospital took out so much of money. It is not, the story is not that. There is another side of the story also, which today Dr. Sabyasachi is telling you that how much pain, just think of those fraction of those minutes where a doctor has to decide the fate of that patient and has to go out and face the patient's family members if he cannot save the patient. That can be middle of night, morning hours, anytime, but it is always ready. They all have to be ready. So that's the kind of stress the doctors are taking every day. Now coming back to stenting, there is a particular myth which keeps on going कि कार्डियक इंटरवेंशनिस्ट लोग CABG के लिए रेफर नहीं करते हैं, स्टेंट लगा देते हैं, क्यों ना उनको फायदा होता है उसमें, which is again a myth. I would like to ask Dr. Sabyasachi is exactly when do you decide which is required a CABG and when do you decide that with intervention this will go, in a layman's term, how can we do that?
Okay, yeah. So in this technical cardiology term, we have a syntax score. But if I have to explain in a layman's way, if there are multiple blocks, supposing all the three arteries they are blocked, if the patient is having uncontrolled diabetes, if the patient is 50, 60 years old something or beyond, and uncontrolled diabetes, multiple blocks, then it is wise to send the patient for a bypass surgery for better result. Because here if you put stents, then there is a propensity for the stent to get blocked because of this uncontrolled diabetes and all. But if you have a single lesion, single artery lesion, now nobody likes to go under the knife. This is a bad truth. No patient likes to go under the knife.
Yes.
If there is an option that you can go through a small perforation, which is stenting. We go through this radial route or hand route, or we go through femoral or this leg route. With one small perforation, we do everything. And in this bypass and this CABG, what you call, there has to be this big slit.
Big cut.
Yes. So nobody wants to go under the knife. So for that reason, even I say 90% of the patients, they want to have stenting with small perforation. But again, I said they have to trust their doctors. So we have certain guidelines. So if there is a single artery lesion and all, and if a primary case, patient all of a sudden he got a heart attack, he comes in 30-35 minutes, he comes very fast to the emergency. Then if there is scope that the lesions are minimum, then and the pain is severe, then stenting is imminent. I meant to say there is no other option. But if there are multiple blocks and if there is no more pain has healed and patient is okay, if there is diabetes and many other factors that I said, syntax score is it's a scoring system for cardiologists which we make. If it is more than 33, then that patient is eligible for bypass. I mean to say the result are better for bypass. If it is less than 33, then stenting can be done and patient can be on the safe side. So these are the certain criteria.
Yes. So Dr. Sahab, in Kalinga, we are having a latest Cath Lab now. We have in which you are working. So what are the latest technologies? I've heard that TAVI is a good technology. What are the latest technologies which intervention cardiologists are using for minimizing and maximizing the medical outcome and minimizing the mortality?
No, again, it depends. I mean to say, you mean to say in Kalinga Hospital?
Nahin.
Okay.
Suppose what is TAVI? What? Because people keep seeing these advertisements, ki we are using IVAS, we are using TAVI. So what is it?
Yeah, okay. TAVI is it's related to the valvular disease, the aortic valve. So any valvular stenosis, elderly male calcified. So now TAVI has become an option that, as I said, people don't want nowadays to go under the knife.
So
Yes. So, but it's a very costly affair also. And this IVAS and all what you said, this is a very recent development. Recent time to say, okay, it would be again 5-10 years. It would be, but it is not there in most of the hospitals. IVAS is an imaging. With this imaging process, what you do, we take that inside the coronaries to see. Supposing we call lesion or the block. What is the quality of that block? Is it a hard block? Is it a soft block? Is it a calcium loaded block? How much severity is the block? So there is a camera that goes inside the coronaries, which gives us the entire every meticulous description about the block, so that we can be more precise, we can be more accurate in our intervention. So this is IVAS, OCT. So OCT is another camera also. So this imaging has brought a very great revolution in this intervention.
In the medical field.
Yes.
Yes. So coming back to the end of the Kalinga Med Talk, what we want to wind up this session and we would like to say is that I will say a small incident, एक छोटी सी incident मैं बताऊंगी मेरे career का, is that I suddenly got a call by when I was working in one of the hospitals that a 40-year-old surgeon who had done 2 surgeries in the morning went to the doctor's room and was resting and waiting for his 3rd surgery and had a little chest discomfort. And वो पहले दिन भी उनको थोड़ा सा chest discomfort हुआ था. There was a cardiologist, he just pushed him, did a investigation, pushed him to the Cath Lab, and there were 2 blockage and there was ballooning and stenting done. Whereas this doctor which I am talking about, he's a renowned surgeon who did not have any kind of symptoms ever, and he was just 40 or 41 years old. Now he got saved because he took that decision of going to a cardiologist. So to the end of today's session, what I would like a last note from Dr. Sabyasachi Raut is that what is your message to the viewers as a cardiologist and what you would like them to follow?
Awareness and getting self-educated. Now YouTube, social media is very active. So if you go into social media, you will see there are a lot of instances. Now Madam hinted about a surgeon. Who are the most neglected people? It's us. Because we are so busy in addressing the patient's calls and their problem that most of the times we fail to address ourselves. It's not overconfidence that yes, we are immune to everything. It never happens. But we don't get time to think about us. And in that process, what happens? If something happens, then sometimes we take it easy. Okay, no, this is there. Okay, let me finish this work or let me finish this operation. And then I will address myself. But as I said, cardiac disease is not going to give you time. Time is muscle. There is only one heart. Our body has 2 organs also. I mean to say 2 organs like 2 hands, 2 legs, 2 eyes, 2 kidneys, everything. 1 kidney you can keep, 1 kidney can be donated also. But only one heart. That is working from birth. It is the only machine which is
going to go
picking
to
from birth,
death,
going till end.
Absolutely.
Years together.
Yes.
You cannot afford to be complacent if there is any heart problem. Only when you can come to, and you shouldn't shy also coming to a cardiologist. And no, just it would be gastritis. Now, why should I go to a cardiologist? No, nothing. You never know what is lying inside. Physical fitness or this gym, going to hitting this gym and building a muscle, okay, that is physical fitness. Physical fitness cannot always be related to your cardiac fitness. Now both are different things. A very strong looking hunk or very strong looking man, 23, 24 years. Now he can't always have the thought that I am safe, I am immune from anything. It's not always true. Just I told before, so Mr. Odisha, how he got a massive heart attack and all his notions and perception, it changed all of a sudden. So for that reason, because in today's life, it's a stressful life. We are not eating healthy. Our sleep is not proper. So there are a lot of things, and you never know some genetic familial diseases which would be there inside. So there are a lot of things, precipitating factors, pollution, that can attribute towards a cardiac disease. So it is always better to be safe than to be sorry. It is our own life and one life. So it is in our hands how to save it. So if you love yourself, you love your heart, you love the cardiologist, and you would come to us for a checkup, so that we would prefer, or we would always wish that you go away from us with a smiling heart.
To end with today's session, today's Kalinga Med Talk, my message, what Dr. Sabyasachi said, is doesn't mean that you're fit and you look very slim and trim and very nice. Doesn't mean that you have a healthy heart. Today, Government of Odisha, and there are a lot of health schemes which are supporting cardiac diseases, cardiology. Don't hesitate to come to the hospital. Here at Kalinga, we of course take in all the health schemes. We are empaneled with most of the PSUs. So get yourself checked. It is very important at the right time. Thank you. Meet you again for the next episode. Namaskar.